The sternum is a sword-shaped bone that lies in the front and center of the chest and connects to the ribs. Similar to the ribs, the sternum is also classified in 3 sections. The uppermost section is called the manubrium. The jugular notch rests on top. On either side of the jugular notch are the clavicular notches. The manubrium connect to the body of the sternum through the sternal angle. Along the body are costal notches, which is where the ribs articulate. The sternal body articulates with the xiphoid process, the most inferior section, through the xiphoesternal junction. Back up at the clavicular notches are the sternoclavicular joints, which allow the sternum to articulate with the medial ends of the clavicles. The clavicles are responsible for bridging the sternum and acromion processes together. The lateral end of the clavicles connects to the acromion processes, which is also known as the acromioclavicular joint. There are 3 types of ribs that make up the thoracic cage, starting with true ribs, which make up the first 7. They are directly connected to the sternum and articulate with costal cartilage. Next, ribs 8 through 10 are false ribs. They also connect to the sternum with costal cartilage, but they do not directly articulate with it. The third and final type of ribs are floating ribs, which do not encompass the entire chest, and they only articulate with the vertebral column. Each of the 12 thoracic vertebrae has costal facets, which are small indents where the 12 ribs connect through costal vertebral joints.
Now onto the muscles of the thorax. The rectus abdominis, otherwise known as the abs, originate from the 5th to 7th costal cartilages and the xiphoid process, and stretches all the way down to the pubic bone. The function of the rectus abdominis is to tense the anterior abdominal wall. When the muscles contract, it also is able to perform flexion of the lumbar spine, which is important for respiration and strong exhalation. It is also used for strong intra-abdominal pressure that allows childbirth and defecation. Working our way up is the external oblique, which originates from the 5th to 12th ribs and is highly connected to the serratus anterior and the latissimus dorsi. The muscle runs caudeo-medially to then insert on the half of the iliac crest and the linea alba. The linea alba is a fibrous structure that runs down the midline of the abdomen from the xiphoid process to the pubic symphysis. Functions include contralaterally rotating the dorsi and bilateral contraction to flex the lumbar spine. The external oblique also supports forced exhalation and increases the intra-abdominal pressure. The serratus anterior has 3 main parts. The superior part stretches from the 1st and 2nd ribs, and then all the way down to the superior angle of the scapula. The intermediate portion stretches from 2nd and 3rd ribs, and will go all the way down to the medial border of the scapula. The inferior portion runs from the 4th to 9th ribs, and then goes to insert on the medial border and also the inferior angle of the scapula. The latissimus dorsi runs from the vertebral column across the posterior side of the rib cage to the intertubular groove on the humerus. At a closer look is the internal intercostal muscles, which originate from the upper border of the rib and then insert at the lower border of the rib above. The function of these is to tense the intercostal spaces during deep inspiration and exhalation to support breathing. The transversus thoracis is a thin muscle on the inner surface of the anterior thoracic wall, which also helps with breathing. The pectoralis major has all the fibers inserted together at the crest of the greater tubercle, and the muscle runs from the shaft of the humerus to the sternum and clavicle, acting almost as a blanket over the 5 ribs. The first 5 ribs. The pectoralis major is the most important muscle for adduction and anteversion of the shoulder joint. The muscle also lifts the trunk, which can be helpful in climbing or during inspiration. The pectoralis minor originates from rib 3 down to rib 5. Then it inserts on the coracoid process of the scapula. The function of the pectoralis minor involves the elevation of the 3rd to 5th rib, then expands the rib cage. The other muscles include the subclavius, which is between the clavicle and the 1st rib, the internal oblique, which is similar to the external oblique, but instead of going over the ribs and attaching to the ilium like the external, it runs from the tips of the ribs to the ilium and inguinal ligament.